inferior vena cava. And at the same time, you have blood that's coming from your lower body that goes to this blood vessel called inferior vena cava. And the inferior and the superior vena cava carry blood to this chamber called the right atrium. And when the atrium contracts, the blood goes to this valve called the tricuspid valve. From the tricuspid valve, the blood enters this chamber called the right ventricle. And when the ventricles contract, the blood goes to this valve called the pulmonary semilunar valve and goes to your pulmonary trunk. From the pulmonary trunk, the blood goes to these two blood vessels on both sides. This one and this one, called pulmonary arteries. And from the pulmonary arteries, it goes to your lungs, get oxygen, and then come back to these two blood vessels on both sides, left and right, pulmonary veins. And from the pulmonary veins, it goes to your left atrium. And when the atrium contracts, it goes to this valve here called the bicuspid valve or mitral valve. And from the mitral valve, it goes to your left ventricle. And when the ventricles contract, the blood goes to this valve here called the aortic semilunar valve. And from the aortic semilunar valve, it goes to your aorta. Now this part of the aorta is called ascending aorta, is going up. And when you see the curve, it's the aortic arch. When it's going down, it's the descending aorta. Now, some of the blood of the aortic arch goes to these three branches. On the right side is your brachiocephalic trunk that goes to your right side of the body. And this one that goes to the left side of the head, that's the left common carotid. And this one carries blood to the left side of the left arm, that's your left subclavian. And then you have these two blood vessels that carry oxygenated blood to the heart. So the one on the right side is the right coronary artery that branches into marginal arteries. There's marginal arteries. And then go all the way in the back to form the posterior interventricular artery. Now for the left side of the heart, you have the left coronary artery that splits into the circumflex artery and the anterior interventricular artery. Now for the veins, you have the great cardiac vein, small cardiac vein, middle cardiac vein. These three veins carry deoxygenated blood to the coronary sinus. And from the coronary sinus, the deoxygenated blood goes to the right atrium, to this opening right here called the opening of the coronary sinus. Now once the blood goes to the opening, to prevent the blood from going back, the valve will close. That's the valve of the coronary sinus. And same thing for the inferior vena cava. Once the blood comes in, to prevent the blood from going back, you have this valve right that's closed. That's the valve of the inferior vena cava. Now for the conduction system, the signal starts with the SA node. And once the SA node fires the signals travel to both atrium, and then both atrium contract at the same time. And then the blood goes to the ventricles, right? And then the signal travels to the AV node right here. The AV node will slow down the signal to allow time for this to fill with blood. And once the ventricle fills with blood, now the signal travels to the bundle of His. And the bundle of His splits into two. The right branch of bundle of His and the left branch of bundle of His. And from the bundle of His, the signal travels to the Purkinje fibers. And the Purkinje fibers will signal for the contraction of the ventricle. And the structures, you have the fossa ovalis. And at the end of each AV valve, meaning the tricuspid and the bicuspid valve, you have these structures called chorda tendineae. And the muscle that holds the chorda tendineae to the heart is called papillary muscle. Papillary muscles. And the muscle for the atrium is pectinate muscle. And
what are the muscles?
And the one for the ventricles are called trabecular carni. Trabecular carni. And then this part of the heart is the apex. And then you have this structure called ligamentum arteriosum. And for the respiratory system, this is the trachea right here. That's split into primary bronchi. And each primary bronchi splits into secondary bronchi. And around the trachea, remember this structure called tracheal cartilage, the wings. And this is for the GI tract, that's the esophagus. And that's it.
As I know,